Hi, everyone. It's Dr. T here with a quick episode in midstream, if you will, in the middle of the week, because there's an important issue going on and a big question that we need to answer. And that is what's in the big, beautiful bill, so called, that's working its way through Congress right now. So this bill has been passed by the House in May, and it is now in the Senate. And essentially what it is it's an attempt to rein in government from the Republicans' perspective, to cut back on certain kinds of government spending in order to fund tax cuts for the wealthiest among us, millionaires, multimillionaires, billionaires. But there's a lot more embedded in this bill. It's over 1,000 pages long. Very few people have had the opportunity to read the whole thing. And so I want to talk about some of what's in there in case you're wondering whether you should be in favor of it or not. So most of the area that's being cut in government, because this has been a long project for Republicans, they say government is the problem. They want to cut back on government spending. But they're cutting only certain things. They're cutting essentially the social safety net, the social programs that many of us rely on. So huge hits, almost $1 trillion to Medicaid, also to food stamps and other food assistance programs. This is really problematic because it is going to be a problem for small hospitals and rural clinics. Many of them, half or more of their population, rely on Medicaid to provide their health care. And so these hospitals are living on Medicaid funding. If that funding gets cut back, many of them are going to disappear. And that means people who already have to go a long way to get to a hospital. I have to go over an hour away. For example, I'm up in the Adirondacks in New York. And people with hospitals that are already far away may have to go even further to get assistance due to these cuts. The other thing that's really of concern here is that Medicaid serves a lot of our elderly who are in full-time care, either in long-term nursing care or in rehabilitation care after something like a fall or a broken hip or that kind of thing. And so what's going to happen to these elderly family members? Where are they going to go? They're in these institutions already because their families can't take care of them. And so where are they going to go when these Medicaid cuts come through? There are other additional cuts that are going to be coming in addition to those, right? I'm just hitting kind of the big points. But what's going to happen is because they can't cut enough from social spending to pay for these multi-trillion-dollar tax cuts for the wealthy. They're not cutting military spending, for example, to try to get that money. So what that means is they're going to have to borrow a lot more, and they're going to cross the borrowing threshold that will kick in something that's called sequestration. Sequestration means that you are going to have across-the-board cuts that will be mandatory in the federal government to try to bring down the borrowing. And what that means is while they're saying they're not touching Medicare, Medicare will see cuts under sequestration that will be triggered if this bill passes. So it's going to hurt primarily our elderly as well as our veterans. They will see a lot of cuts through sequestration. Now, Republicans have been pushing this idea that everybody's going to see tax cuts. Yes and no. Those who are near the bottom of the economic ladder, particularly people making $50,000 and below or even $75,000 and below, they're actually going to see their costs increase because they're going to have cuts to services that they rely on. So they're going to be paying more money. The poorest among us will lose money under this bill. Those in the middle may get something of a benefit, but only the tune of about $1,000, $1,500, somewhere in that range, depending upon your income. Of course, people making over $500,000 are going to see a tremendous increase in the tax benefits that they're going to get from this bill. Other things to be aware of. Now, this is a budget bill, so it should just be about what we're spending and what we're taking in. But Republicans are using this bill, as Democrats have in the past, to further some of their policy agenda. And so one of the things that they're doing is trying to rein in the judiciary. They've been unhappy that Trump's executive orders have had so many judges ruling against it. It's because he's pushing the law. He's trying to see how far he can go. That's why they're trying to rein him in, because a lot of things he's doing are illegal or unconstitutional. But the Republicans are trying to rein in the judges, and so they're removing the power that the judges have when they hold people in contempt. So you get held in contempt if you ignore a judge's ruling, which the Trump regime is doing right now. The judiciary would have no teeth. They'd have no way to enforce. So they could go ahead and rule against the administration all they want. They have no way to enforce it. So that would essentially give the Trump regime carte blanche. They could not be held accountable by the judiciary. They're also attacking abortion. So right now, the federal government, since the 70s, has prohibited any federal dollars from being used to pay for abortions. So that is not even on the table. No federal dollars pay for abortions. But what they're trying to do now is make sure that you cannot get any service paid by Medicaid if you go to a nonprofit organization that provides any abortion care whatsoever. So it doesn't matter what kind of care you're going for. If abortions are provided there, you cannot get Medicaid funding. So this is a blatant attempt to shut down Planned Parenthood specifically. And the estimate is that about a third of the clinics nationwide will shut down. Now, Planned Parenthood provides a wide range of medical services, including cervical cancer screening, breast cancer screening, gynecological care, access to contraceptives. When I was a poor college student, my parents were self-employed and did not have health insurance. So the only way I got care was to go to Planned Parenthood for my yearly gynecological exam. They allowed me to pay on a sliding scale. So as a poor student, I could afford to actually get the care that I need. But this is an attempt to try to shut down Planned Parenthood. This bill also would punish any insurance company that participates in the Affordable Care Act exchanges. And about 10% of our population gets their insurance through these exchanges. And they are subsidized in multiple ways through the federal government, directly to individuals, to the insurance companies. And this bill would wipe out subsidies to the insurance companies if they provide abortion care, if they cover it in their policies. So it's a way to punish them financially, which means they're trying to get them to stop covering abortion care. Other things in this bill: attacks on the environment, wiping out a lot of the green energy things that Biden did using the same process under his administration, including things like credits for electric vehicles, trying to wean us off of our fossil fuel habit. The other thing that they're doing, we all know that they've been devastating our national parks, and they've cut long-term professionals, botanists, and wildlife management experts. But now what they want to do in this bill is make up to 250 million acres of our national forests, national wildlife refuge, places adjacent to our national parks, available for sale. That means they could be logged off, oil drilling. Not only would we not have access to them, but they would be destroyed. Another provision a lot of people are not aware of is that there is a 10-year moratorium on any state or local regulation for artificial intelligence. What that means is no state or a local entity could rein in artificial intelligence in any way. We already know this is a problem. Right now, if you haven't heard, Memphis, Tennessee is having a terrible time with Elon Musk's center for trying to crunch all of this information, right? His AI project is creating tremendous pollution in that community. And this bill would say communities have no right, states have no right to try to regulate that tremendous pollution is having a detrimental impact on people's health and well-being. The other thing that we should be really concerned about is that there's new information coming out now from multiple sources. This isn't just one place, where people working with AI are trying to make sure that we still maintain control over it, that it still responds when we say, turn yourself off, right? We've all seen the movies where the computer takes over and bad things happen. We're trying to make sure that doesn't happen. Artificial intelligence is already smart enough to try to thwart that. So it's starting to rewrite its code or refuse shutoff orders. And so we should be concerned. We should be concerned about who is in control of artificial intelligence. And letting it run wild for 10 years could be something that we really live to regret. We also know that there are tech billionaires. Elon Musk is one. Peter Thiel is another. He's the one who bankrolled J.D. Vance, who got him his senatorship in Ohio and has supported him as the vice president. He is doing his own thing. He's got his own AI project. He's creating his own giant database. He's got access to a lot of our sensitive information. Do we really want people to be compiling all this data on us that allows us to be watched, to be surveilled, to be tracked, to be monitored much more closely and much more easily. And this is just the beginning, right? This big, beautiful bill is really just beautiful for billionaires, and in particular, tech giants who are billionaires. If any of these things alarm you, and there's a lot more in here that I could go into, but I'd be going way over my time promised to all of you. Now is the time to say something. You can go to senate.gov, and there's a drop-down box where you can click on your state and find out who your state senators are if you don't know, or if you do know who they are, look up their names. You can get their contact information. You can call their offices in DC. You can call their state offices. They usually have several offices around their state. You can call all of them. That's what I do. You can go to house.gov and put in your zip code, and it will tell you who your representative is, or if you know, you can put their name in, and you can find out all their contact information. And they will have a number in DC and a district office that you can call. Again, I call both those numbers. So right now, the senators are the ones to focus on, because that's where the bill is right now. They'll make adjustments and it'll go back to the House. But of course, the House has to vote on it again. So if you care about any of these things, let your concerns be known, and do your own research about other things that are in this bill. You can Google things like, what's in the big, beautiful bill? Why should I care about the big, beautiful bill? How is it going to affect something you care about? How's it going to affect veterans? How's it going to affect the elderly? And there are people who've been digging into it and doing this kind of work. I've given you just a taste. But if you are concerned, please speak up. You have that right. Use it while you can.